for our cancers, we often don't have a good reason, like we do with some of the other more common solid tumors, like lung cancer or colon cancer. There are certainly some viral infections that may play in as a risk. Sometimes it's occupational exposure. In general, patients need to kind of practice healthy living and healthy lifestyles. And then certainly getting into the course of treatment, lifestyle modifications are important and prevents kind of further complications, particularly while people are getting their therapies. Treatment for blood cancer specifically requires kind of a group effort. And because of all the services we have at the Georgia Cancer Center, I think we're able to kind of encompass all the care for the patient. Not only do we have standard chemotherapy treatment options, we also have clinical trial options to explore alternative treatments. It's a mix between people getting therapy in the hospital and in the clinic. So we have an excellent inpatient hospital service that's specific to oncology patients, and really a floor of the hospital that's specific to blood cancers. And so you have really specialized nursing care on that hospital ward. Likewise, in the clinic, we have a blood cancer clinic and specialized nursing care. All our patients have access to a nurse navigator to kind of help them through the complex system. We have access to surgeons and other surgical subspecialists that can assist if people need biopsies or port placement. Also, we have excellent pathology here, and so some of these diagnoses are quite complicated, and so it's really important to have good pathologists to help kind of determine specifics of disease, because that's very important in selecting the right therapies. So, how do these patients present? I guess is a good common question. So because this does often involve the blood, typically what we see is patients' counts start to drop. And so the white count may rise, and that may often be a marker of the disease taking off. But despite the white count being high, people's immune systems are suppressed. So they're at risk for infections. So a lot of times they present with an infection, and part of that workup discovers the cancer. We also see low counts developing, so people can become more anemic, and with that they can have symptoms, typical things like shortness of breath or severe fatigue or fainting spells, even if the counts are getting too low. And then the platelets drop as well, so those help make blood clots or stop us from bleeding, and so people may have bleeding issues or easy bruising. Those tend to be, for my world of treating lymphomas, the lymph nodes can become enlarged, and so people may feel lumps or bumps in the neck or armpit or in the groin. And then weight loss, some of the other lymphoma-specific symptoms are drenching night sweats and eye spiking fevers that aren't related to infections. And so, I always caution people, it's really unusual symptoms that don't go away. So things that kind of come and linger, certainly talking to your primary care physician about those are important. People should be seeing a physician regularly, kind of the cancer screening. From a blood cancer standpoint, often we find these on routine blood work, and so people may not have a lot of symptoms, but they have their routine labs, their white count's high, they're anemic, and that leads them kind of down the path to getting a workup and a good diagnosis. So I think having established primary care, really keeping your own health at the forefront of your thoughts. I do want to stress the importance of getting the COVID-19 vaccination. I think that this is very important, not only personally for a person to have it to help prevent them from getting COVID, but really spreading it throughout the community. And we deal in a population of cancer patients that are on therapies. They have suppressed immune systems, particularly in my line of work with the blood cancers. And so we're really dependent on as many people as possible getting the vaccination to not only protect yourself, but really to protect your community. And you never know who's sick and who's on treatment and who is that vulnerable person, because they look like normal people out in the community.